Hello and welcome to the Unbound Medicine webinar titled Disaster Nursing and Emergency Preparedness. My name is Brian Carey. I'm VP of Marketing here at Unbound. The webinar will be about an hour, and if there's time at the end, we'll be fielding questions. To submit a question, simply type that question in the chat box at any time, and we will try to answer at the end. If we don't have time or run out of questions, the speaker will answer your question and it will be emailed to you. The webinar is being recorded and will be posted shortly. You'll all be emailed a link to the recording. First, let me tell you a little bit about Unbound Medicine. Unbound Medicine builds digital products that answer clinical questions at the point of need. With expertise in medical informatics, health technology, and medical publishing, our team has delivered innovative mobile and web solutions to hundreds of healthcare institutions and over 4 million individual clinicians for over 17 years. Our speaker today is Dr. Tenner Goodwin Bienema. She's an internationally recognized subject matter expert in disaster nursing and public health emergency preparedness. Dr. Bienema is currently an associate professor and pediatric emergency nurse practitioner at Johns Hopkins School of Nursing. Dr. Bienema has served as a senior scientist to the United States government, including the Department of Health and Human Services, Administration for Children and Families, Department of Homeland Security, Department of Veterans Affairs, and most recently, the Federal Emergency Management Agency. She's written 3 books on this subject, one winning the distinguished AJN Book of the Year Award. Dr. Bienema has won numerous awards in her distinguished career, including the Florence Nightingale Medal of Honor from the International Red Crescent in 2013. This is the highest international award a nurse can receive. At this time, I can turn it over to Tenner, where she can walk you through the presentation.
Good afternoon, everyone. It's a real honor and pleasure to be here with you today via the internet, and I'd like to thank Brian Carey and all of my colleagues at Unbound Medicine for the invitation to spend this next hour with you talking about a subject that's really near and dear to my heart, and that's helping prepare our national nursing workforce for disasters and large-scale public emergencies. And so what we're going to cover today, we're going to touch base on some recent disaster events that have really sort of shown the light on the importance of this content to all of our nation's nurses, whether they're students, pre-licensure, new graduate nurses, or nurses working in practice, education, administration, public health, or research. This content is really relevant to all nurses. We're going to touch base on the U.S. healthcare system and its level of preparedness in order to manage and handle disasters and public health emergencies. Talk a little bit about what we can do in the nursing profession to enhance surge capacity and what that means. Most importantly, I'd like to spend some time talking about, from my perspective and that of others, what nursing's role and responsibilities are in disaster response and the real contribution that we can make. We're going to touch base on crisis standards of care and how we decide that the moment has come that it's appropriate to implement those standards. And finally, we're going to close up this webinar by touching base on some resources that we believe are available to you to help you support your nursing workforce in providing quality and safe care during disasters. And then, as Brian said, at the end, you'll have an opportunity to submit some questions, and I'll look forward to having a robust conversation with you. So I think the big question, and one that's always on all of our minds in terms of disasters and emergency preparedness, is, are we ready? How prepared are we as a nation really to respond to disaster events involving large numbers of victims? Fortunately, we don't see these events frequently. We are concerned about those low frequency yet high impact events that may result in a sudden unanticipated demand for health care. And we recognize that right now we are currently within our U.S. healthcare systems frequently struggling to meet the daily needs of patients given the multiple challenges that the healthcare system is encountering in terms of changes to payer patterns, changes in terms of an rapidly aging population with a high burden of chronic illness, and again, just the fact that we're in a rapidly changing healthcare environment. So we recognize that as a national healthcare system, we need to put emphasis on making sure that we develop appropriate levels of capabilities in order to address a very wide range of events, including terrorism, disaster scenarios, and public health emergencies. And then we come together today to ask the question, what does this mean for nurses? So again, as I mentioned a moment ago, we know that our healthcare system is currently working oftentimes at the brink of capacity, and that many of our emergency departments are already functioning in somewhat of a disaster mode on a daily basis due to the demand for patient care and limitations in beds and resources. We know that nurses have a lot of concerns about this and about the many different types of disaster events or public health emergencies that may occur. And when we talk about disasters, we are defining that as any type of event where the demand for health care exceeds the available resources to meet that demand. And we know that the origins of these types of events come from a number of different arenas, hazards in our environment that create risk. So whether we're talking about climate change, changing patterns in El Nino, we recognize that we have seen a rather dramatic increase in the frequency and intensity of natural disasters and weather-related disasters. We also recognize that human-caused events continue to occur in terms of war, acts of violence, active shooters, terrorism. And then finally, we know that we have another whole series of hazards that exist within the realm of chemical, biological, radiation, nuclear, and explosive events. So just to touch on a couple of these that have occurred recently, we harken back to the Boston bombings of April in 2013. We then go on to remember last fall's horrific attacks in Paris, where most unexpectedly, there were random acts of violence resulting in activation of the entire healthcare system in the greater Paris area. Last year also saw the concern regarding emerging infectious diseases, most significantly MERS in Southern Asia and in South Korea in June in particular. The 2014 through late 2015 global Ebola outbreak really pointed a laser focus for all of us in terms of, one, how a global epidemic can quickly overcome what we thought were World Health Organization readiness, and that had implications for us here on U.S. soil in terms of revealing some deficiencies in hospital preparedness, in surveillance, in nurses' role in helping to implement disease containment strategies. And then finally, seasonal flu continues to be an ongoing annual threat, recognizing that we may see anywhere from 30 to upwards of 48,000 deaths per year resulting from flu. Last December in 2015, Trust for America's Health, which is a watchdog healthcare organization that publishes an annual evaluation of U.S. healthcare readiness on a state-by-state basis, published their most recent report, Outbreaks: Protecting Americans from Infectious Disease. And most alarmingly in this report was that more than half, 28 of states, continue to score a 5 or lower out of a possible 10 on key indicators that are directly related to preventing, detecting, diagnosing, and responding to infectious disease outbreaks. And in light of all of the work that has been done in response to the MERS and Ebola outbreak, I think this really is a lesson learned for those of us going forward in the healthcare system to continue to work on efforts to improve our surveillance and detection and to also strengthen the national nursing workforce in terms of its understanding of its role in disease containment. Let's touch base quickly on a number of other hazards that we are concerned about when we talk about preparing nurses for disasters, mass casualty events, or public health emergencies. We have been concerned since October of 2001 and the anthrax outbreak anthrax attacks of that time period regarding the use of biological organisms in bioterrorism. And so anthrax, botulism, plague, smallpox, tularemia, and all of the viral hemorrhagic fevers continue to be a concern. And hazard chemicals, materials, or hazmat emergencies are also real threats to all of our communities, given the amount of industrial and toxic waste that are moved through truck and trains across the United States, toxic releases, either accidental or intentional, as a result of production of agriculture and energy. We've seen an increase in a number of environmental disasters, from the Gulf oil spill to other releases of chemical contaminants into our environment, and finally, transportation accidents as well. Radiation continues to be a major concern in terms of the Department of Homeland Security and the Department of Health and Human Services as it relates to the U.S. healthcare system's ability to respond and manage scale radiation release. This may result from emergency, such as we witnessed in Japan in March of 2000 in terms of the tsunami and the Fukushima disaster. This may be a random industrial radiation release, or potentially, again, an act of terrorism involving a radiation dispersal device, or more colloquially known as a dirty bomb. Finally, we continue to have growing concern over certain to the United States that they could potentially possess and use nuclear level weapons. So what we really are thinking about here is, how can our healthcare system manage a sudden or rapidly progressing influx of patients at a given moment in time? And we refer to that as our surge capacity. We know what our healthcare organizations can handle on a routine daily basis, but in the event that a large-scale disaster or outbreak occurred that involved a sudden leap in the number of patients seeking health care, we recognize that that would create a very unique situation and significant demand on our healthcare systems. So when we're talking about surge capacity, we're really talking about the staff, the stuff, and the structure that we need to be able to rapidly ramp up and meet that demand for healthcare in the patients and families who seek us out. Surge capacity continues to be one of our biggest health preparedness weaknesses, not only for hospitals, but other community-based healthcare organizations will also see a sudden increase in the number of patients seeking care. And so what we really need to do is brainstorm different strategies and solutions for acquiring the supplies, equipment, staff, and the space that we need. And many of our hospital emergency operations plan have built in those annexes to accommodate that surge in patients. What's most important to consider for us today, however, is the critical role that nurses play in surge capacity, what they need to know in terms of knowledge, skills, and abilities to participate in that type of a response, and then making sure that we've created a healthcare environment where they will be willing and able to participate. So some of the things that are unique to disaster response, we've touched already on surge capacity and the importance to be able to see flexibility within our healthcare system to accommodate this demand for care. We also need to consider the use of the Hospital Incident Command System as a framework for leadership. It's an all hazards management framework that allows for seamless communication and a structured format that everyone understands who's in command, who's communicating to whom, and what their role is within that incident command system. If we talk about a large-scale infectious disease outbreak, we may need to be talking about point of distribution clinics, which again is a real nurse-sensitive contribution to surge capacity. The establishment of point of distribution clinics for the purposes of mass vaccination or mass treatment protocols. We really need to anticipate what the barriers to response for nursing may be and how we can strategically overcome those barriers, again, seeking to create environments that will be safe for nurses to respond, that will encourage them to be willing and able to respond, meaning we need them to either stay at work or come to work during times that may be quite chaotic and ambiguous. We want to talk a little bit about allocation of resources because by definition of the event, a disaster is when the demand will exceed available resources, thus forcing us as nurses to consider different strategies for allocating who will get care. Whenever we talk about allocation of resources, particularly scarce resources involving making decisions about who will get care, who is prioritized for care, we need to make sure we employ a solid ethical framework for that and triage models that will optimize health outcomes for as many of our patients as possible. Finally, disaster events also require us to consider potential alterations in our daily standards of care, and we move to something called crisis standards of care, and I'm going to talk about that a little more in a moment. Crisis standards of care are those that we implement based on a very prescribed set of triggers when it becomes apparent that there is no option to continue to care for patients the way we do on a normal daily basis and still achieve the outcomes that we want to achieve. And I urge you to seek out some of the reports issued by the Institute of Medicine and the guidelines and toolkit that has been issued for hospitals and healthcare organizations in terms of the appropriate implementation and the legal and ethical framework for implementing these crisis standards for care. Obviously, something that we want to do as a last resort. I think it's important that we recognize that disasters and public health emergencies may have a disproportionate impact on certain sectors of our population, those who are more high risk and highly vulnerable, such as the elderly, those encountering disabilities, and infants, children, and adolescents, because they require that we make special accommodations in our nursing preparedness and response in order to make sure that we optimize outcomes for these highly vulnerable populations. There's that old saying in hospital disaster preparedness, you don't know what it will be, but you know it will be coming. And while we cannot anticipate or prepare for every type of disaster or predict the magnitude of that event, we are expected by our accrediting organizations, whether it is JCAHO, whether it is the Centers for Medicare and Medicaid, that hospitals and staff are prepared for any emergency situation that may arise. And we in the nursing profession recognize that the survival rates of victims and our patient outcomes will depend upon the ability of our hospitals and our community health organizations to handle that sudden influx of mass casualties and how well prepared we are to begin with to handle those emergency situations. Let's talk for a moment about what's unique about nursing during a disaster or public health emergency event as opposed to what we do in daily practice. And certainly one of the first things that may potentially change is the model of triage that we employ. As opposed to normal daily practice where we use our acuity-based triage models, where we try to identify the sickest person and treat that person first, devoting the majority of our resources, we need to reconsider that paradigm and recognize that when we have large number of patients presenting, our goal shifts to doing the greatest good for the greatest number with the least amount of harm. That is the deontological rule that guides the implementation of models of disaster triage. Again, triage is our first step in doing a very methodical and fair and equitable allocation of scarce resources, always seeking to continue to render the highest quality care we possibly can, protect the quality of that care, and protect the safety of our nursing staff, other healthcare providers, and the patients themselves. Many of the disaster events that we've touched on today will require the use of decontamination. These models of decontamination are very specific to either chemical or radiation exposures, and this is a whole unique strategy or healthcare intervention that many nurses practicing today may not have had any education or training on. Decontamination requires the use of personal protective equipment. Also, as in the case of many infectious disease outbreaks, we need to move beyond universal precautions to more advanced OSHA standards for personal protective equipment. We saw back in 2003 with the SARS outbreak in Toronto, Canada, many nurses became ill and died at use of PPE. And again, most recently with Ebola, we saw that many nurses did not have the level of understanding and skills to appropriately select, put on, don, and doff that personal protective equipment to keep themselves safe, their colleagues safe, and to protect the patient. Another strategy that is a bit unique to a large-scale public health emergency is our disease containment strategies and the use of surveillance, isolation, quarantine, and other forms of containment in order to prevent secondary transmission of disease. We move to a different health systems approach within our hospital and health organizations when we have an event occur that requires the activation of the Emergency Operations Systems Plan, the activation of an Emergency Operations Center, and ongoing event management in order to try to do the best job that we can do and meet the demands of all of the patients and families who are seeking help. As I mentioned earlier, we see the implementation of an incident command, most usually the hospital incident command system, as our framework for command and control in an all hazards approach to really responding and managing and implementing recovery from this disaster event in an effective manner. And then finally, this requires a high level of crisis leadership and managerial decision-making on the part of nurses who are in administrative or executive roles or are perhaps senior faculty at schools and universities. The nurse's role in managing disasters and public health emergencies is consistent with our norms of healthcare professionalism. Meaning that the values that guide planning and response both at the leadership level and at the unit level, and those norms of healthcare professionalism continue to be relevant to clinical decision making during all types of disaster events: disasters, terrorism attacks, public health emergencies, and those include an ethical duty on the part of the nurse to provide care and non-abandonment, to maintain a respect for all persons, our duty to benefit and prevent harm, fairness, and recognizing that it is part of our professional responsibility as a nurse to be prepared to respond. Years ago, there have been a number of studies done on nurses' willingness and other healthcare providers' willingness to come to work during a disaster. I did a study with colleagues back in 2008 specific to a radiation emergency to really look at, will nurses come to work? Will they stay at work? Are they willing to protect their patients from harm? And what that study showed is that willingness to respond to a disaster, or in this case particular a radiation health emergency, was very dependent on that clinician's sense of clinical competence, their perception of their own personal safety, and their confidence in the safety of their family and significant others. And these findings are quite consistent with other studies in the published literature regarding willingness to respond. The good news is that hospitals and healthcare organizations and schools of nursing can do a lot in terms of providing knowledge, education, and training to help increase that nurse's sense of clinical competence during a disaster, and to create environments where nurses perceive that they are personally safe and it is safe to come to work and stay at work. Most recently, we've conducted another study here at Hopkins looking at what are those components of crisis leadership and decision making that are most important to ensure excellence in disaster response. And that's solid decision-making skills, clear and ongoing communication, the physical embodiment of leadership qualities, and a strong willingness to lead, understanding of the hospital or healthcare system's organizational culture and using that culture to facilitate a strong response, and then education and possessing good disaster management skills. In our study, the 5 events that most concerned our hospital administrators and our executive nurse leaders were the ongoing threat of a major infectious disease outbreak, active shooters, because we have recently seen quite a bit over the past 3 years in the United States, terrorist events, riots, and bomb threats. So again, I think one of the things that's most important as we go forward talking about how do we take a workforce, a nursing workforce within a healthcare organization, and prepare them adequately for a response. Clearly, we need to provide them with ongoing education and training regarding the different types of disaster events and the implementation of a hospital incident command system to guide our response from the unit level on up, but also to ensure that all nurses are clear and understand the appropriate selection and use of personal protective equipment. And this can be done by participation in drills and tabletop exercises, in online modules, and in just the repeated encouragement of opportunities to properly don and doff personal protective equipment. We have here at Hopkins tried to create a number of different educational opportunities to improve access to high quality evidence-based education in disaster nursing for all of our nation's nurses. And last year, in conjunction with the Center for Emergency Preparedness and Response here at Johns Hopkins University, we offered a MOOC, a massive open online course on disaster preparedness for the healthcare professional that had almost 4,800 students participating from across the United States and some international students to help, again, provide current, valid, and reliable content, screened, collated, organized in a very usable format for healthcare providers to understand their role and their responsibilities and the framework for disaster response within health and hospital and healthcare organizations in the U.S. Um, I'm very proud to have partnered with Unbound Medicine and with an amazing team of subject matter nurse experts within the realm of disaster nursing and public health emergency preparedness to produce an app for the iPhone and iPad specific to disaster nursing. We spent over 2 years researching and collating, collecting evidence from the Center for Disease Control and Prevention, from the National Library of Medicine, Disaster Information Management Center, and many other high quality sources for clinical and health systems information to pull together an evidence-based, competency-driven resource for nurses, irregardless of their practice site or whether they are a new graduate nurse, working registered nurse, advanced practice nurse, nurse executive. We wanted to pull together an app that would provide nurses and nurse leaders with a real-time reference and an evidence-based resource for all types of crisis decision-making and clinical leadership. We're very proud of what we've produced, and again, I have to call out to the marvelous team that contributed to reviewing every aspect of this app. We had some very seasoned nurses from the Public Health Service Corps, the VA, Health and Human Services, and many universities across the country that helped contribute to reviewing this material and ensuring that we produced the highest quality app we could for our nation's nurses. You see on the left of your screen the menu in terms of one example. There are over 400 different disaster events or infectious disease pathogens that are listed within the app. You're seeing an example on the left of our menu in terms of what is included on each of these 400 topics: the associated morbidity and mortality, environmental effects. The nursing implications are clearly specified, as well as guidelines for personal safety and the use of PPE, assessment of the event, and every phase of the life cycle of that disaster, what needs to occur throughout preparedness, mitigation, response, and recovery. We provide references for each section and images where it's appropriate. Again, here's another screenshot of the earthquake template that we've provided within the app. Also, I want you to note that as nurses use this app and become more proficient at it in terms of being able to use it for real-time access to information or guidelines for response or clinical interventions, they're able to note favorite pages and to add notes to different topics that are there. The roles and responsibilities of nursing within each of these events are clearly articulated in terms of the significance of the nurse's role, the content, and the implications. And again, we're just really excited about this and felt that of all of the information that's out there, being able to organize it in a way that's most easy for a nurse to use and access was the greatest value that we could create. We will continue to work on building strong resources for disaster nursing. The app will be updated on a regular basis. We were pleased to see that we had Zika virus in there when the CDC's warning was issued 2 weeks ago, and that reinforced to us that we do have a comprehensive database of pathogens within there. To really highlight a few key points of this presentation and to help you as you move forward in thinking about how can I better prepare my nursing workforce, I ask you to consider these key points: that we recognize and remember that disaster events are increasing in their frequency and intensity, and that because of population movement towards coastlines, we are seeing an increase in our vulnerability. We recognize that these disaster events create uncertainty for the U.S. healthcare system, and that we are a key critical component of the National Health Security Strategy and the implementation plan that the federal government has for the next 4 years in order to strengthen the U.S. healthcare system and our ability to respond. As nurses, our contribution is a key component of strategic objective number 4 of the National Health Security Strategy, which is to enhance the integration and effectiveness of public health, healthcare, and emergency healthcare systems, with workforce development being a key component of that strategy. We all recognize that we need a national nursing workforce that has the knowledge and the skills and the abilities to respond to any type of disaster or public health emergency in a timely and appropriate manner. We recognize that nurses may be first responders, but in much more likelihood will be hospital-based first receivers, and that will not be limited solely to nurses and advanced practice nurses practicing in the emergency department. Most often, many other units will be involved as well. I want to take a moment just to focus on the importance of personal and family preparedness to all of us. The importance of personal and family preparedness really is the foundation of organizational preparedness, and we recognize that nurses are more likely to come to work and stay at work if they feel comfortable that their family, their parents, their loved ones, their pets, their friends are safe and being cared for as well. And that is a personal responsibility of each nurse to make sure that their affairs are planned for at home. There are multiple strategies that I've used in working with hospitals and healthcare organizations for helping to teach their staff to become personally prepared and to implement activities, preparedness activities that enhance staff collegiality and collaboration. We've used a number of different models, from sponsoring 100% readiness unit activities to the implementation of work buddy systems to ensure coverage and a sense, again, of personal safety and clinical competence to respond. Finally, unit level preparedness is a key component of organizational preparedness as well. And I urge all hospitals and healthcare facilities to ensure that they have stocked adequate PPE enough to cover all of their nursing staff. So really, in summary, we talk about disaster nursing as if it's a unique sort of subspecialty niche area, but in reality, disaster nursing and public health emergency preparedness is a patient safety and quality of care issue, and it's one that is best addressed now, not during a disaster. We recognize that personal and family preparedness is critical for organizational preparedness, and that most practicing nurses today still need education and training regarding this sphere of possibility in terms of disaster and public health emergency response. We believe that all nurses need access to valid, trustworthy, reliable resources, and that the use of these resources can directly contribute to keeping nurses safe, which we know keeps patients safe.